Hello and welcome to this American Heart Association goRED Talk, presented by Yale New Haven Health. I'm Dr. Eric Velasquez, the Physician-in-Chief of the Heart and Vascular Center at Yale New Haven Health, and the Robert W. Berliner and Chief of Cardiovascular Medicine at Yale University. Our vision here at Yale New Haven Health is to enhance the lives of the people and communities we serve. It's a part of our mission to create healthier communities. Working with the AHA, we have created a series of talks around health equity and wellness topics aimed at helping you that will help you live a longer and stronger life. We hope that you find these talks informative. Now I would like to introduce today's presenters who will discuss how COVID-19 affects your hearts. Please welcome cardiologist Dr. Desai of the Heart and Vascular Center at Yale New Haven Hospital and an associate professor at Yale University, as well as Dr. Victor Mejia, co-director of the Cardiac Catheterization Laboratories at the Heart and Vascular Center at Bridgeport Hospital.
Hi, Nihar. Thanks for joining me today, for having this conversation about COVID and the heart. Yeah, as we're unfortunately getting deeper into this major wave that we all expected, I think it's important for us to take some time and talk about the impact that COVID can have on the heart. I know that both of us have had the experience of the first wave and have seen our patients kind of go through a lot of different things as it affects the heart. One of the things that we know is that people that have cardiovascular disease are obviously at an increased risk for suffering complications from COVID. It's, I think, something that we need to kind of understand a little bit and better, but also explain to our patient population what it means. I know from my experience, when patients have come in with COVID, and as they get more and more sick and more ill, their heart is one of the main things that can be affected in a few different ways. And from my perspective, one of the things that I've seen is that it's been very difficult to tell the difference between patients that are having heart attacks in the setting of COVID versus damage that we are actually seeing from the virus itself. I think that's something that's very important to understand. What's your take in terms of how our patients with heart disease can be affected by COVID?
Yeah, Victor, it's a great point, and I think it's great to be with you. And I know it's a very challenging time for all of us. I think your point about as we enter this kind of another wave of COVID, to kind of talk to our patients and the communities about what they should know about COVID and the heart. And I think there's a number of important principles that you have kind of raised. First, we know that patients that have cardiovascular disease, that have coronary disease or heart failure or other cardiovascular risk factors, tend to have a more difficult time with the virus. And so again, it's very important for you to see your doctor, take your medications as they're prescribed, have all of your risk factors kind of well controlled. And so I think that's sort of one important piece of this. I think the other piece of this, and something that we've learned, is this may have initially been thought of as a respiratory virus, or a virus that primarily causes pneumonias, but we've seen that it can actually affect many different organ systems, including the heart. Mm-hmm. And that, to your point, it can cause the heart muscle to become weakened. It can cause heart attacks. It can affect the body in many different ways. And I think those are things that we continue to learn more about as time goes on. I will say that it's reassuring to hear that we may have a vaccine coming, that there are some treatments that have been shown to be effective. But first and foremost, I would say to everyone in the community, to everyone that's listening, please heed the advice of the public health professionals, the public health community, that everyone has a role to play in stopping the spread of this virus. And that's social distancing, wearing your masks, getting your flu vaccine. If you're feeling ill, quarantining, and then seeking medical attention if and when you need. Those are things that we can all do together to try and get through this. So, I think it's a really important, discussion, Victor, and I'm curious kind of, what else you've seen and what else you would kind of share with the community.
So the point about getting care, I think it's incredibly important. One of the things that we saw during the first wave was that people would stay home. We saw a drop in the rates of people coming to the hospital seeking emergency care when they were having acute heart attacks or acute stroke. And obviously the fear of getting COVID is a very strong one, but at the same time, we need to be careful and heed the symptoms that you're having and listen to the advice that we're giving you, that if you are in need of emergency care, do not be afraid to get that. Unfortunately, a lot of people that were having heart attacks did not get the proper care that they needed during the first wave. Obviously, we worry about the exposure to COVID, but having gone through the first wave, we have learned a lot, and we have implemented a lot of procedures and policies in the hospital to do the very best we can to avoid the exposure while you're in the hospital. And for ourselves, for our institution, we actually did a great job just by the sheer number of staff that were not infected. We had an incredibly low number of staff that were infected during the first wave because of all the policies that we put in place. And so we can't avoid and forget that when you do have the need for emergency care, you should seek and get that care.
Yeah.
One of the things, Nihar, that I think we also kind of don't know yet is the effects that this virus will have in the long term. What are you seeing, or what have you seen in terms of how the virus may affect the heart after people have had the virus?
Yeah, Victor, it's such a great point. I think, one of the things that we've learned is even after individuals have recovered from a COVID infection, that there is a suggestion that there can be long-term presence of the virus actually in the heart, and that it can cause inflammation in the heart. The long-term consequences of that, I don't think we know yet, but I think another important point that I think follows the one that you were just making is if you've had COVID and you've recovered, your medical team is going to suggest that you have very close follow-up from your primary care doctor, maybe from a series of specialists. And that's very important that you sort of continue to get that care so that we can watch things and monitor things and make sure that if you need additional treatments or therapies, that you can get those in a timely way. Should you have symptoms that are worrisome, please pick up the phone, call someone, and get to the hospital, get to medical attention, because the effects of COVID and sort of in keeping people away from the hospital can be just as as potentially devastating as as what COVID has done to too many communities and too many families thus far. So if you need care, please do get it, and know that everyone on the team here is doing their absolute best to make sure that you have the best experience, that you get the best care in the safest way possible.
Yeah, absolutely. And like you said earlier, we all have to stay the course, wear your mask, wash your hands, keep your distance, and the vaccine is close. Obviously, it's going to take several months for it to be widely distributed, but it's close. So we just have to be patient and stay the course.
Yeah, no, I think we will get through this together, and we'll be stronger, on the other side, through it. And so, everyone has a role to play, and we look forward to sort of working together and getting to that, getting to the other side of this.
Well, Nihar, great points today. I think this is very informative.
No, thanks, Victor. It was great to be with you, and all best to everyone out there, and wish you all the very, very best.
Likewise.